OMIDRIA is one of the most important and simplest decisions you're ever going to make. Why would I not want to use a product that improves patient outcome in the cataract surgery portfolio? OMIDRIA is one of the best treatments that I have for improving surgical outcomes and achieving better visual acuity with less complications in my patients coming to me for the best possible cataract surgery I can provide.
The biggest advantage of OMIDRIA for me is the fact that I don't have to worry about unexpected things happening during surgery. So often our patients don't remember if they're on medications that put them at risk for floppy iris syndrome. And we get this unexpected constriction of the pupil and movement of the iris during surgery that makes it harder. And if I can think that during surgery that isn't something I really need to be concerned about, the iris will stay stable, it will be the safest approach I can have, that's reassuring to me and takes some of the stress out of the day for me as well.
So my advice to surgeons that haven't tried or used OMIDRIA is first, try the product for two reasons. One, if you're a doctor that's not currently using NSAIDs perioperatively, the data is convincing, and this was decided long ago that NSAIDs perioperatively make a big difference in the quality of outcome, the experience patients have, and your ability to perform good surgery, even making you more efficient as a surgeon. So if you're not currently using an NSAID, then this is a no-brainer to begin using OMIDRIA in your practice. If you are a doctor that believes in NSAIDs already and understands that data, then the advantage of incorporating OMIDRIA is first, it removes those compliance errors where patients really haven't preloaded. I now control that compliance by putting it in right when we need it. Second, it allows me to make sure that I achieve the right concentrations for those where there's been lower absorption for any of the reasons that can affect corneal drop absorption. I now can ensure that I have the right concentration and I have all of those advantages. So my advice would be to try the product, and it will be obvious to you its advantages in maintaining the pupil and affecting the quality of the surgery and your patient experience. And the proof will be in the trial, and it will be obvious for you.
For any surgeon who's thinking about using OMIDRIA that's not using it yet, I would say call your rep and just try it. You know, they can help you with billing, they can help you figure it all out. It's super simple and it's there, and then you can assess it for yourself and see what you actually think. I have found that it's been really helpful.
When somebody looks at me and says, why OMIDRIA? I say, why not? I mean, you know, I'd like to use it in everybody's, but if I had my choice, OMIDRIA would be for everyone for me because it adds so much. And simply, one of the simple things I like is it allows people to see much quicker. So I just presented my data in Milan and showed that patients are seeing 20/16 with both eyes at the same time on their second eye surgery, around 80 to 85% of the cases. And those are my OMIDRIA cases for the most part because I'm reducing inflammation intraoperatively before it even starts.
The advice I would give to a new surgeon who's using OMIDRIA early on is you need to check your payers beforehand to make sure that the patient is covered. Most patients have very good coverage these days, so we're very fortunate for that. Also, you know, I think once you start using it, you'll find that you want to use it more and more. So you can start with, you know, maybe a patient that is a higher risk, such as a pseudoexfoliation patient who has a small pupil, a diabetic patient that maybe doesn't dilate very well. But I think once you start to gain more and more experience with OMIDRIA, you want to use it on almost all of your cases, and certainly it makes the case a bit easier, more efficient.
If you're thinking about using OMIDRIA, it's pretty simple. Basically talk to your rep and have them help you integrate it in the time of surgery. It's basically putting a vial of this medicine, of phenylephrine and ketorolac, into the bottle. There's no setup time for the surgery, no setup time for the staff, working with your rep, and therefore you start first 5-10 cases. And actually what I would also recommend is compare first 5-10 cases with and then without, and see how's the behavior of the iris. And look at your post-op inflammation, post-op regimen, and you yourself can see the difference as well.
If you wanted some advice on OMIDRIA, it's if you can use it, you should use it. Why do you want your life to be harder? Pupil dilation is what makes the surgery seem easy to you, makes you make the right moves when you need to. You just don't want to be in the dark when you're trying to operate on somebody and give them the vision that's going to make your practice a better practice.
For somebody not using OMIDRIA or have not tried it, I would highly recommend getting some samples, using it, especially on your patients with a history of floppy iris syndrome. We see that in men and women, so it's not just men that have that problem. In a matter of 2 or 3 or 4 cases, they will notice a difference in the ease of doing surgery with the iris staying dilated. You could even try to use the OMIDRIA intraoperatively if you have a patient that you didn't expect to have floppy iris or pupil constriction, and insert it, and you'll have a nice dilated but definite stiffening and tightening of the iris structure to aid in your ability to complete the case.
I have a program, a cataract refractive fellowship program, and almost all these fellows I've had over the last 6-7 years have had no experience using OMIDRIA, and they asked me the first day, like, what's different in surgery? What's easier? Why is it easier? Is because the pupil's staying the normal size that you want from the beginning to the end of the case. You have less floppiness, you have less surprises of a pupil going kind of goofy on you during surgery. So the fellows love to see, as newer surgeons, how OMIDRIA makes their life easier, makes the surgery less complicated majority of the times, and it avoids issues. As you know, we want to always avoid complications, and so I can't even think about the number of times OMIDRIA has probably saved me throughout my career in the last 8 years, and I don't know how I'd be able to operate without it. So you got to at least try it, and you'll see the difference.
I guess my advice would be to just try it. You know, you can hear anybody saying what benefits a medication is going to have during surgery, but we're in a specialty that's kind of skeptical on new things because there's a lot of new things that kind of come and go. My advice would be just to try it, and kind of the proof is in the pudding when it comes to outcomes and quiet eyes and lower complications with related to small pupils.
You know, for those surgeons that have not had the opportunity to have experience with OMIDRIA, I would say you really want to get that into your surgery environment as soon as you can. There's just so many benefits for the surgery center to offer that there's really no reason not to. You know, sometimes there's a barrier because of some of the financial considerations that are present there, but at this point, I think that you know, most of those issues have been worked out very well, and an ASC can actually, you know, generate some revenue by using OMIDRIA. For the surgeon itself, it just makes the procedure go so much smoother, reduces the likelihood of a lot of complications that could potentially, you know, make the surgery last much longer, increase OR times, all those sorts of things. So there's a lot of benefits to be thinking about when you're considering bringing OMIDRIA into the surgical environment. And I would just encourage any surgeon who hasn't tried OMIDRIA to really give it a try. There's almost no reason not to, and certainly you can, you know, try with some samples and see how you do with that. But you know, for us, it's a huge part of our surgical experience.
If a surgeon is not using OMIDRIA currently, but is thinking about using OMIDRIA in the future, one thing to know is that it's very easy to use. We use it on almost every patient, so the staff knows how to prepare it, and it's very routine for them. On the patient side of things, using OMIDRIA allows for a little less stinging for the intracameral lidocaine, and again, it allows for a little bit faster or a little bit more efficient cataract surgery, and that allows for less pain and less inflammation following their cataract procedure.
My first response when a surgeon asks me, do I recommend OMIDRIA and why? And I say, why not? Why not take the advantage of a larger pupil for every case and greater effective treatment for inflammation? So it really is a why not. I don't see a downside.